Hi, welcome to our YouTube channel. Today I'm going to talk about one of the types of treatments we utilize at our medical clinic. We have an integrative medical practice and I treat a lot of cancer patients who have failed conventional therapies. We use a lot of different treatments here in our practice and I advise patients on various approaches to treating cancer. This includes intravenous therapies, nutritional supplement, counseling, hyperbaric treatments, and one of the types of treatments we use in our practice is medical cannabis. In Florida, medical cannabis became legal for use and recommendation by physicians approximately 2 years ago. I have some notes here on cannabis and cancer so I don't forget to cover some of the points, but the first thing I'd like to cover is cannabis utilizes a system that exists in all human beings, and that's called the endocannabinoid receptor system. The two molecules that have an enormous benefit are THC and CBD, and this is something people ask me about all the time. THC is classically the molecule in cannabis that has psychoactive effects, the one that gets people high, if you will. So that's that component. CBD component has anti-cancer effects, anti-seizure effects, and when you combine them, in addition to other types of terpenes that exist, terpenes are little molecules that also have medical effects. That's called the entourage effect. So the first point I'm making here is I tell patients when they can, the entourage effect and the combination of all these systems together against the cancer growth is the most beneficial approach when possible. Some people cannot handle one of the molecules, but nonetheless, that's the best approach when possible. Second point I have here is Rick Simpson oil. Rick Simpson was an engineer from Nova Scotia, Canada, who created Rick Simpson oil, which is an oil that is made from the raw flower of cannabis, and he treated his own post-concussion disorder. Then he treated his own skin cancer with excellent results, and after that, thousands of people have used his oil with success. When you join the medical cannabis registry in Florida through a valid physician such as myself, you have access to all the products that the different dispensaries are able to put out, and Rick Simpson oil is one of the products that is used against cancers. So that's a nice feature of joining the database. The third point I'd like to make is one of the ways cannabis defeats cancer is something called the IDP1 gene pathway. The IDP1 gene is a gene that causes cancers to grow aggressively, and THC and CBD block that pathway. So another example of our ability to use botanical science to fight cancer. Number 4, they have directly injected tumors with medical cannabis, and that has also resulted in cancer killing. These were brain cancers, other types of tumors like breast cancer, so medical cannabis has direct killing effects through other pathways. A fifth reason that medical cannabis is often utilized and we see great results are in patients who have stage 4 cancer that don't have appetite, and cannabis has the ability to increase appetite, and that's a great thing for patients who are suffering from stage 4 cancers, and sometimes it's due to effects of chemo and radiation that they don't have any appetite. Sometimes it's due to the cancer directly, and medical cannabis is an excellent stimulant to stimulate appetite in these patients, especially when they're using a comprehensive integrative cancer approach. The sixth point I'd like to make is that medical cannabis also has anti-inflammatory effects, and cancer causes inflammation in the body through different types of mediators and receptors. So another bonus for using medical cannabis against cancer. And the final point that a lot of people ask me about is, what is the best way to take in medical cannabis? Is it to vaporize? Is it a tincture? Is it smoking it directly? Is it the capsules? You know, each approach should be customized to individual patient preference and the disease they're fighting. I tend to stay away from smokables if someone's having a lung cancer, or even vaporizers. I might suggest tinctures or capsules are better. Suppositories are also possibilities, and edibles will be coming out in the future. So there are multiple ways the patient can ingest these very important molecules in order to fight their cancer. We have now had about 2 years of experience using medical cannabis with our cancer patients, and I'm very pleased with our results, and I'm very pleased with the results of our anti-cancer program in general. So if you'd like more information, we'll leave our contact information on this video, and thanks for watching.